Hey again, ZengoMD. Early in my career, I had a number of patients complain of pain, fatigue, insomnia, and moodiness, and they all blamed the symptoms on stress. And I would reply back to them, wow, if we only had a test for stress, we could probably figure that out. Then, once I found a test for stress, I changed my whole practice, and the rest is history. And in a few minutes, you too will find out what I learned back in 2006 and have practiced ever since. In our first video, called A Fresh Look at Stress, we introduced you to this guy, Hans Selye, who in 1936 described stress as the nonspecific response of the body to any demand. He got nominated for a bunch of Nobel Prizes and authored a book called The Stress of Life. His work quickly associated the adrenal glands and eventually cortisol as an integral part of the hormone stress response. And we have learned since then that a whole lot of hormones nearby in the steroid cascade may also play a role in stress. Here we have the sex steroids, and here is the main hormone that regulates salt and water balance. The commonly known physiology of stress is that a stressful event increases activation of the sympathetic nervous system within a second, and the HPA axis gets stimulated, after which results in the release of cortisol. However, even when there is no stress at all, this HPA axis is always running, and it's responsible for much of our quality of life day in and day out. See, our cortisol levels are not zero when we have no stress, but what happens when all you do is wake up with no alarm and stroll out of your beachside bungalow to the pristine sands where you were delivered your meals and drinks all day? Is that stressful? Sure isn't. Are you still making tons of cortisol? Yep. And this is the function of cortisol that most experts ignore. Just try to look up the non-stress functions of cortisol. Good luck finding much on that. Every hour of the day, stress or no stress, cortisol in the daily rhythm of the adrenal regulates the following functions: blood sugar regulation and storage of sugar as glycogen in the liver and in muscle. Immune system regulation. You know, they give you massive doses of glucocorticoid steroids, which are synthetic analogs of cortisol to shut down your immune system when you have asthma or an allergic reaction. Well, too little cortisol compromises the immune system also. You need the right amount for that perfect balance. Regulation of inflammation. Salt and water balance, there's that aldosterone again. It can play a minor role with blood pressure and, of course, body clock. Now let's plot the normal daily cortisol rhythm. This is wake up and here is bedtime. It peaks a few minutes after wake up and then falls as the day goes on, cutting in half at lunch and half again by supper and hitting its low point at bedtime. This is an incredible 20 times difference between the highs and lows of the day. No other hormone is quite like this. In contrast, the disease Cushing's looks like this: overproduction with little rhythm resulting in weight gain, elevated blood sugar, and sleeplessness. And Addison's looks like this: underproduction with little rhythm, responsible for fatigue, sluggishness, and some electrolyte disturbances. These disease states are easy to understand and rare. Traditional blood tests can easily pick up these extremes, but nobody really looks for the nuances in the green curve, where most of us live our lives day after day, because variations of the green curve that do not approach the red or the yellow one are not considered diseases. Yet the non-stress functions of cortisol as the main sleep-wake cycle or body clock indicator is the most woefully underemphasized physiologic pathway in all of medicine. It is well known that cortisol peaks shortly after wake up and then slowly declines as the day goes on. When it reaches its lowest point, we get drowsy, go to bed, and sleep deeply so we can recharge our body clock and wake up again tomorrow with a cortisol surge and a full burst of energy to do it all over again. Cortisol is essential to convert those sleeping brainwaves into active, awakened brainwaves. It wakes you up by supporting the expression of excitatory neurotransmitter expression in the brain. And it helps you wind down at night, opening the door for natural melatonin production and sleep onset and deep sleep support. Well, now let's go back to Hans Selye again. He proposed a general adaptation syndrome, where all three phases of chronic stress are expressed. Through research on laboratory animals subjected to chronic stress, he concluded that there are three phases: alarm, resistance, and exhaustion. And he correctly attributed the adrenal gland as the pivotal mediator of that response, since he looked at and weighed the adrenal glands of his laboratory animals at each stage in the process. Now, let's look at daily production of cortisol over months to even years as the stages progress. So here's the curve, And again, these are 24-hour daily cortisol levels measured. You see that it rises in the alarm phase, which can last days to weeks, maybe months, then drops back to actually normal for 24 hours in resistance before falling and staying down in the exhaustion phase for months, years, who knows how long. Later on, beginning in the 1970s or so, we learned that any of these stages of stress can be repaired or even reversed with an appropriate amount of physical activity. And later stages can be managed, if not reversed completely, with meditation, yoga, and biofeedback, in addition to nutritional therapy. This showed that while the conscious mind may not be responsible for the initiation of the alarm phase, it can play a role in the resolution of that response. And that brings us to the $1 million, $129.99 question. How can we objectively quantify what kind of effect chronic stress has on our bodies? Have you ever been offered an objective test for your stress level at any price? Has it ever been brought up in a medical encounter? When you merge the stages of stress by Selye and the well-known daily cortisol rhythm, we have the most reliable test for stress. It's called, we'll tell you after the commercial break. Oh, wait, we have no sponsors. Well, I'll give you a hint first. Now, if you've not seen our video on the validity of saliva testing since 1959, thousands of papers have proven the validity of salivary cortisol levels, effectively use them to prove the impact of stress in a variety of stressful situations, like when NASA used them in testing astronaut training. Salivary cortisol testing references are increasing rapidly in the medical literature, and it has also been endorsed by a number of endocrinology organizations for the diagnosis of Cushing's disease. And they are excellent at measuring spot levels at a moment in time, as the salivary gland is constantly filtering hormones from the blood and dumping that into the mouth as saliva quite quickly. The best test for stress we have is the 4-point salivary cortisol. And here is what that salivary cortisol curve looks like when testing at 4 different times in the same day. First sample is 30 minutes after wake up, then before lunch, before supper, and bedtime. This first graph looks pretty good overall. This one looks like resistance or maybe late alarm phase with that midday rise. And these two are differing levels of exhaustion. Each of these has a different treatment approach designed to mold the stressed curve back to the normal pattern. This can take anywhere from a few weeks to a few months, depending on the magnitude and duration of the stress-induced changes involved. Patients are often amazed how much I can tell about their daily energy and moods just by reading this one little test. So much that one patient recently thought I was listening in on her personal assistant speaker since I knew her so well. I told her someone's probably listening, but it's not me. And remember, none of these curves represent disease, but they correlate well compared to all of the diseases we get assigned by mainstream medicine. Like when you wake up tired and sluggish here, or the after-lunch crash here, the snapping at the children after school, and the mind racing at bedtime, which keeps you up at night even though you were tired all day. Without any kind of objective testing, we can assign you diseases and drug treatments at each and every step. Like adult ADD, take some Adderall here, and a little high-dose caffeine here. This represents depression, so I guess you need some Prozac. And this is the code for insomnia, so we'll give you some Ambien. 3 prescriptions, 3 diagnoses, with some high-dose caffeine thrown in, and you're cured, right? Well, none of these are bioidentical replacements for what is missing. None of these require an objective test prior to the prescription and to evaluate the progress. Stress sells drugs. The question you want to ask yourself is, does this person really have 3 diseases that require 3 different treatments? Or is there a single factor, stress in the body clock response, that simply overcompensates to try to protect you from that stress? Look, you can do whatever you want. These drug treatments are legal and the standard of care, at least for now. And if they work well for you, then great. But for most of my patients, these remedies did not work in the past, or they had tremendous side effects, and we need to dig deeper and look for some proof and a different approach. Stress matters, and this test is the best we have right now. So what does your stress curve look like? Well, come and see us and we'll go over it in person with you. I've interpreted over 10,000 salivary cortisol levels in my career so far. Or if I'm not in your area, look for other providers near you who are skilled at interpreting a cortisol diurnal rhythm salivary test. And put a number on your stress. Find out which of Cellier's stages of stress you're currently suffering from and work toward rebuilding your body clock. Well, that's all for now. Thanks a lot. Bye-bye.